There's a lot of thought out there that the mind and the body are not just connected, but that they're inseparable, kind of like two sides of a coin. Right? And so the impact of the body and the mind, kind of interact with each other when it comes to physical stress and overall health. Your mind controls or influences everything in your body. Distress in your mind inevitably results in stress and tension within your body. So, likewise, every insult to your body affects your mind. You can't be sick or injured without it having an emotional impact. Postural imbalances, pain and tension in your body strongly influence your mood and how you think. Each muscle and nerve cell and virtually every structure in your body is physically connected to everything else. Um, so it's this web that assembles your body into a type of interconnected and interrelated structure. Health psychology emphasizes psychology's role in establishing and maintaining health, preventing and treating illness. When we look at behavioral medicine, this focuses on developing and integrating behavior and biomedical knowledge to promote health and reduce illness. Health promotion involves helping people change their lifestyle to optimize their health and assist them in achieving balance in physical, emotional, social, spiritual, and intellectual health and wellness. And then public health is concerned with studying health and disease in large populations, and this helps to guide policymakers in some of the policies and decisions that are made internationally, nationally, globally, etc. So here we have our biopsychosocial model on this slide. And so what we see is like this connectedness between the mind and body, right? So the biopsychosocial model includes biological, psychological, and social factors in health. Stress can be an influence in all these areas. It might be fascinating to think about how the mind may influence bodily health, but it's also important to appreciate that the body may influence the mind as well. So health and wellness may influence an individual's psychological experiences, such as cognitive efforts, stress, and coping. In the theoretical models of change, this suggests that effective change requires people to have specific intentions about their behaviors, as well as having positive attitudes about a new behavior, and to perceive that their social groups look positively on the new behavior as well. So when we look at the theory of planned behavior, it encompasses the theory of reasoned action and includes the person's beliefs about control over the outcome. The stages of change model describes the process where people give up bad habits, they adopt healthier lifestyles. It breaks down the behavioral changes into the 5 steps, right? Pre-contemplation, contemplation, preparation, determination, action and willpower, and then the maintenance to continue that behavior long term. So as we're working on building this change, we are sometimes faced with relapse, and then we have to go back and evaluate the different stages. So pre-contemplation is like when you have individuals that are not really genuinely thinking about change. They may not even be aware that they have a problem or a behavior that needs to be changed. Contemplation is when they realize that they have a problem, but they're not yet ready to commit. So they may think about it, they may talk about it, but they're really not making any plans to do anything about it. And then the preparation and determination is when people get ready to make the change. You've committed to doing this change. You're researching what's the best way for you to go about it. And then the action and willpower is when you commit and you come up with a plan and you're actually doing new things to develop this healthy behavior or pattern, right? And then we get to the maintenance. So we've gotten there, we're making progress, we're, really, getting this healthy behavior under control, and we're changing our lifestyle. It's become a part of who they are, and then relapse happens. And so we have to, we return to these former unhealthy patterns, but we need a plan in place to address this when it happens. And so it's a common aspect of change to face relapse, but it can also be discouraging. when that happens. So we want to make sure that we have something in place that's going to help us when we reach that stage. So when we look at resources to, help us make these changes effectively, implementation, intentions, motivation in general is a pretty big part of that. We want to make sure we have the right tools for motivation, that we're changing things for the right reasons. Change is most effective when you want it. You can't do it for somebody else. If you want to lose weight, you have to do it for you. If somebody else is telling you or somebody else is, suggesting that you should, it's not going to work. Intrinsic motivation here, that's what's going to benefit you. You have to be intrinsically motivated to want to change, whether it's stopping drinking, changing your eating habits, increasing exercising. You have to want it. Right? It's important to get feedback along the way, from others, but you have to want to navigate this change for yourself. Right? Social relationships that you have are important and can be beneficial in making this change in your life. You get a lot of benefits from social support, like tangible assistance, information sometimes, emotional support. Your family and friends can provide you information. They can help, if you face a stressful circumstance. We want to get information from people, and we want that emotional support so that when we, struggle or we're, being discouraged, getting discouraged, other people can help us. Sometimes religious faith can help people change. So weekly religious attendance relates to a lot of healthy behaviors. Participants may also benefit health through that, relationship and social support from that organization. And then, personality characteristics, right? So some that are related to health are like being conscientious, having control, self-efficacy, optimism, all relate to our personality characteristics of change. So like I said on the last slide, motivation is so important when it comes to being intrinsic and wanting change. We want to make these changes to better our lives, right? We want this personal growth to occur. When we define, motivation, we often look at internal and external, right? But this internal, you're putting 100% of your time, your effort, your energy, and focus into attaining your goal, right? Into achieving what it is that you set out to change. And so that's, your internal. That's going to come from within. So there's, like this internal positive and internal negative that we have sometimes. Internal positive is like this challenge, desire, passion, satisfaction, self-validation, feeling fulfillment off of the changes that we're making. And then sometimes there's this internal negative that sets in that, helps when we have that social support to deal with. And internal negatives can be, fear of failure, inadequacy, insecurities that we have, possible relapses. And so we want to make a plan to address some of these. And that's why having that, social support can be so important in this process of change. Whatever effort you put into this change is what you're going to get out of it, right? And so sometimes there's a disconnect between efforts and goals. And like people say they really want the change, but the efforts that they're making aren't really, meeting the needs of that goal, right? And so that's, where this social support can come in. And sometimes if you want to start exercising or you want to lose weight, find a buddy to go with, right? To the gym, find a buddy to walk with. Find somebody in your house that, might want to eat the way you want to and, in a healthier way. Otherwise, like I said, the religious component too can sometimes help. People that are involved in religious organizations, there's extra support there for helping you meet and achieve and attain your goals. They're not for everybody, but we see like a lot of your AA type meetings, people that want to stop drinking. Most of these are held in churches, right? There's that religious component that's associated with AA. There's that support from the church and the members of the church that can help with uh, that kind of change. So that can be another effort or organization that can help in the change process. If you can't find anybody that's close to you for that social support, there's, online groups sometimes, or like Weight Watchers, if you do a program like that, has online support. Um, I'm not recommending, one program over another, but there are, different chats. I think Noom has something like that. There's an app on the iPhone called MyFitnessPal that, you can download, your friend can download, and then you guys can kind of track each other and support each other that way. But you're making this change, right? So you're going through the difficult nature of making the change, and you're going to likely be putting in an effort that's going to take you beyond the point at which it's inspiring or fun, and it's the grind. You're getting into the daily grind of making that change, and sometimes it's stressful and it's tiring and it's tedious, but you're making progress, right? And that's what's important. And so that social support, those cheerleaders in your life sometimes can help you maintain the motivation to continue. But like I said earlier, internal motivation and you doing it for you, it's what's going to help you commit and start. But it doesn't hurt to have the people cheering for you on the sidelines to help keep you motivated and keep you on track. The different personality characteristics that I mentioned earlier, like being conscientious, right? Conscientious people tend to perform behaviors that are good for their health when they're told to do so. It might also be like the most important of the big 5 traits when it comes to health and healthy living and longevity. The big 5 traits is in your personality chapter. Ocean by Costa and McRae. Openness, conscientiousness, extroversion, agreeableness, and neuroticism. So they're suggesting that this conscientiousness might be the most important of those big 5. Personal control is having a sense of personal control that can reduce the experience of stress during difficult times. Like willpower is part of self-control, personal control. Coming up with problem-solving strategies to help you deal with the stress. Avoid risky behavior that involves health compromising actions. Self-efficacy is the belief that one can master a situation and produce positive outcomes. It's related to success in a wide variety of positive changes. And then optimism, is how a person explains the causes of bad events as being due to external, unstable, and specific causes. Stress can affect the body and you as an individual in many ways. So here you can see how stress affects the body, how it affects the mind, emotions that you have, behaviors that you have. All of these are tied in and linked to stress. So when you're experiencing an increase in stress, you might have more headaches, you might feel more negative, make more hasty decisions, be more restless, suffer from insomnia. Maybe you have an increase in irritability or depression, feeling a little bit more apprehensive about certain situations, or lacking confidence, feeling fatigued. All of those are associated with stress. Chronic stress can have effects on the immune system. Psychonumerology looks at the connections among psychological factors, the nervous system, as well as the immune system. Acute stressors, or like things that are sudden, stressful, one-time events, can cause immunological changes, if I can speak here today. Chronic stresses, which are longer lasting, are related to an increasing downward turn in the immune system's response rather than an adaptation. And then we have like stress and cardiovascular disease as well that can cause more health issues. So this shows our general adaptation syndrome, right? Stress and the stages that we go through. So the GAS for short, has three stages: the alarm, resistance, and exhaustion. The alarm stage, there's a temporary state of shock in which resistance to illness and stress falls below normal. In the resistant, the glands throughout the body begin to develop hormones that protect the body. If the body's all out of effort to combat stress, stress fails and stress persists, the individual moves into the exhaustion stage. And this is the model that affects the hypothalamic pituitary adrenal axis, HPA axis for short. This is a complex set of interactions among the hypothalamus, the pituitary gland, and the adrenal glands. It helps to regulate body processes like digestion, immune system response, emotion, energy expenditure, and it also controls reactions to stressful events that we face. We often think of this as the fight or flight stage when that alarm goes off. It's our initial symptoms that the body experiences when you're faced with stress. Sometimes this natural reaction prepares us to, flee the situation, or are we going to protect ourselves and fight in dangerous situations? Our heart rate can increase. Your adrenal gland releases cortisol, which is a stress hormone. You get this boost of energy, which increases energy. And then, we're going to go into the resistance phase after that. And once we're here in the resistance phase, if the stress is going to continue, the body has to continue to adapt to it. All right. So after that initial shock, the body begins to repair itself. It releases a lower amount of cortisol. Your heart rate and blood pressure start to normalize, and your body enters this recovery phase. It does remain on high alert for a while. And if you overcome stress and the situation is no longer an issue, your body will repair itself until your hormone levels, heart rate, and blood pressure reach a pre-stress state. But some stressful situations that continue to occur for longer periods of time, if you don't resolve those, your body remains on high alert and eventually adapts and learns how to live with a higher stress level. So now we're looking at, irritability, frustration, poor concentration, if this is ongoing in the resistance stage. When we reach stage 3, this is the exhaustion stage. It, as a result of prolonged or chronic stress, struggling with stress for long periods of time can drain us physically, emotionally, and mentally to the point where you just no longer have the strength to fight stress. Signs of exhaustion can include fatigue, burnout, depression, anxiety, decreased stress tolerance. This also weakens your immune system and will put you at risk for stress-related illnesses. So stress as it relates to cardiovascular disease, we see high blood pressure, heart disease, early death sometimes, being excessively competitive, hard-driven, impatient, hostile. These are common personality characteristics of men who have developed coronary disease and is referred to as a type A behavior pattern. So the behavior of the healthier group, who were typically relaxed and easygoing, is considered type B. And so this is, helps us to describe individuals who are sometimes distressed or have negative emotions, sometimes socially inhibited as a result of the stress that they're experiencing. Stress has been related to cancer risk. Stress sets in motion biological changes that involve the autonomic, endocrine, and immune systems. Cancer patients show a reduced natural killer, NK, which is cell activity. So cognitive appraisal is the interpretation of an event as either harmful, threatening, or challenging. The person has to determine whether or not they have the resources to cope effectively with that. And then when we cope, we have to manage these circumstances, figure out how to solve life's problems, seek to master or reduce stress, is all part of our coping. So we have the primary as well as the secondary appraisal for coping. The primary appraisal is our ability to interpret whether the event involves harm or loss that's already occurred, if there's a threat in the future for danger that we're going to face, if there's a challenge to overcome. In the secondary appraisal, we evaluate your resources. You determine how effectively you can be in coping with the event that you're facing. Two other types of coping. We have problem-focused coping as well as emotion-focused coping. Positive is where we face, one's trouble and try and solve it, right? We're faced with a problem and we have to come up with an answer. Emotion-focused is the stress that you're feeling, right? So you try to manage your emotional reaction to something. You're not necessarily confronting the root of the problem, but you're figuring out how to respond to it. People use both of these, problem and emotion-focused coping, in an attempt to adjust to a stressful circumstance. There's several stress management programs that we can utilize to try and help, teach us how to appraise stressful events, develop coping skills, putting these coping skills to practical use. Some of the stress management programs teach techniques to handle stress. Others teach specific techniques like relaxation, meditation, maybe assertiveness training is something that could be taught in these stress management programs. Ultimately, we want to move towards a healthier body, a healthier lifestyle, right? And so that could be becoming physically active and, making, expanding this physical energy that's part of our healthy lifestyle. Maybe it's exercise, and maybe it's aerobic exercise like jogging, swimming, cycling, something that stimulates the heart and lung functioning, eating right, right? We label overweight and obese for those that have extra body weight on them. Sometimes, there is you have to consider what's overweight or obese based on the person's height too, right? Making better dietary choices, right? Helping teach and eat a well-balanced diet that can provide more energy. It can lower blood pressure, can lessen the risk for heart disease and cancer. Quitting tobacco use, stop smoking. That can eliminate your risk for certain cancers. Practicing safe sex is another component for good physical health, right? We want to eliminate the risk of STIs, sexually transmitted infections, as well as reducing the risk of AIDS, acquired immune deficiency syndrome. Right? So practicing safe sex would be, using condoms. These are going to be most effective to prevent gonorrhea, syphilis, chlamydia, as well as the HIV virus or AIDS.